Charlie was 68 years old and doing everything exactly by the book. For men and women over 60, the creeping fear of a sudden medical emergency is always lurking. Charlie was absolutely terrified of having a stroke during his sleep. So he followed all the rules. He took his daily pills. He walked every single morning. He even forced himself to eat the bland, joyless meals his physician hastily recommended during their rushed 10-minute consultations. But last Tuesday night, Charlie's wife awoke to a sound that will haunt her forever: a ragged, choking gasp. Charlie was having a massive ischemic stroke right there on his own mattress. Here is the absolute tragedy of Charlie's story. He did not do anything wrong. He was not reckless with his health. Exactly 45 minutes before his head hit the pillow, he drank something he genuinely believed was relaxing his body and protecting his heart. Something millions of you probably have sitting on your kitchen counter or resting on your nightstand right now. The terrifying reality is that this seemingly innocent bedtime drink creates a lethal, perfect storm in your bloodstream while you are unconscious. It forcefully alters your blood viscosity and manipulates your resting heart rate, silently starving your brain cells of oxygen at 3 in the morning. You drift off to sleep thinking you are taking excellent care of your body, and you risk waking up entirely stripped of your independence, facing the cold, terrifying reality of a nursing home. This is the silent, nighttime threat no one warns you about, because the traditional medical system simply does not have the time to sit down with you, to truly listen to your fears, or to explain the intricate biology of your changing body. But I do. I am here to give you the honest, unfiltered truth so you can fiercely protect your independence. I am Dr. Marcus Caldwell. For the last 2 decades, I have stood in freezing operating rooms, a cardiothoracic surgeon, with the immense privilege and heavy burden of holding beating human hearts in my very own hands. I have seen the devastating, irreversible aftermath of what happens when we ignore the root causes of our failing health until the absolute last minute. I stepped away from the exhausting, broken cycle of 7-minute appointments because I could no longer look my older patients in the eye and pretend a hasty prescription was the only answer to their quiet suffering. The traditional medical system simply does not have the time to sit down with you, to truly listen to your fears, or to explain the intricate biology of your changing body. But I do. I am here to give you the honest, unfiltered truth so you can fiercely protect your independence. Let us have a very honest conversation about who is truly responsible for this hidden danger. For decades, the medical establishment has handed down rigid, one-size-fits-all guidelines that completely ignore the unique biology of your changing body. They treat a vibrant 75-year-old grandmother the exact same way they treat a 30-year-old marathon runner. You have been told your entire life by hurried physicians to stay aggressively hydrated, to consume certain soothing herbal blends, or to drink a large glass of ice-cold water right before you lay your head on the pillow. They print these generic, outdated rules on glossy pamphlets and hand them to you as they rush out the door after a mere 7 minutes of their time. The traditional health system is entirely obsessed with your daytime numbers. They aggressively prescribe daytime blood pressure pills, they measure your daytime pulse, and they lecture you about your daytime diet. But they leave you completely and utterly defenseless in the dark. The medical institutions and the massive health conglomerates are pushing dietary advice that is actively dangerous for aging hearts. They are so fixated on churning through patients and protecting their profit margins that they never stop to consider the devastating nocturnal fluid shifts happening inside a senior body. They fail to warn you how a sudden influx of specific liquids at 10 in the evening violently spikes your blood volume, forcing your heart to pump against immense pressure while you are completely unconscious. If you are sitting there right now feeling a knot in your stomach because you had a glass of this exact drink last night, I need you to take a deep breath. Look at me. Listen to my voice. This is absolutely not your fault. You have done everything right. You trusted the advice you were given by people in white coats. You read the health magazines. You listened to the morning show experts who swore this was a healthy, necessary habit for a good night of rest. How could you possibly have known that this innocent routine was silently thickening your blood and creating the perfect environment for a midnight stroke? You cannot blame yourself for a broken system that treats you like a mere number on a chart. You have been trying your absolute best to protect your health, to maintain your independence, and to avoid becoming a burden to the people you love most. I know exactly how much you fear losing your mobility. I know you dread the thought of waking up in a hospital bed, confused, in pain, and surrounded by strangers simply because a doctor did not have the decency or the time to explain the real science of your own heart. You are not a statistic. You are a human being who deserves the complete, unfiltered truth about your health. You deserve a physician who treats the root cause, not just someone who throws another pill at the symptom. The guilt and the anxiety end right here, right now. Today, we are going to take back your power. Because once you understand the simple mechanical truth of what is actually happening inside your veins when the lights go out, everything will make perfect sense. You will finally understand why you sometimes wake up feeling utterly exhausted with a heavy chest and a lingering brain fog. And uncovering this fascinating nocturnal biology is the very first step to bulletproofing your arteries tonight.
Look down at your hands right now. Trace the faint blue lines running across the back of your skin. When you are in your 20s and 30s, the inside of those vessels is as smooth as perfectly polished glass. Your blood flows effortlessly, delivering crisp, life-giving oxygen to every single cell in your body. But as we celebrate our 60th, 70th, and 80th birthdays, the internal architecture of our cardiovascular system fundamentally transforms. It is a natural, beautiful part of living a long life. The walls of your blood vessels naturally thicken. They lose that youthful, rubbery stretch. The lining becomes slightly textured. Now, I want you to consider what happens to this delicate system when you finally go to sleep. Your body is supposed to enter a state of profound, restorative rest. Your heart rate drops to its lowest point. Your blood pressure dips by 10 to 20%. This is a critical recovery window for your brain and your heart. But when you consume a large glass of plain water, or a standard diuretic herbal tea, or even a glass of warm milk right before your head hits the pillow, you violently disrupt this delicate nocturnal rhythm. I have stood under the blinding, harsh surgical lights at 2 in the morning more times than I can count. I have opened the chests of men and women who went to bed feeling perfectly fine, only to suffer a catastrophic event in their sleep. I have held their fragile, beating hearts in my very own hands. And let me tell you exactly what I see when I make that critical incision. The blood flowing through an older patient who has suffered a nighttime stroke is not the bright, fluid, easy-flowing liquid you might expect. It is dark, it is thick, it is dangerously sluggish. Why does this happen? Because when you drink that heavy volume of liquid just before bed, your aging kidneys are suddenly forced into absolute overdrive while your body is lying perfectly flat. This triggers a massive, unnatural shift in your blood volume. Your kidneys frantically filter out the water, filling your bladder to the absolute brim in the middle of the night. As your bladder swells, your nervous system panics. It triggers a silent, continuous stress response to keep you from wetting the bed, quietly spiking your blood pressure while you remain completely unconscious. But the true danger is what happens to the blood left behind in your veins. because your kidneys just flushed out the liquid portion of your blood to your bladder. The actual blood circulating through your brain becomes severely dehydrated. The red blood cells are forced to pack tightly together. The fluid becomes dense, heavy, and incredibly sticky. In the medical field, we call this nocturnal hyperviscosity. Your heart, which is supposed to be resting, is now forced to pump this thick, sticky sludge through those stiff, narrowed vessels we talked about earlier. It is actively trying to push wet concrete through your delicate circulatory system. This is the exact moment when the risk of a stroke skyrockets. A microscopic clump of these sticky red blood cells catches on a tiny piece of plaque inside your carotid artery. It builds and builds until it forms a solid clot, completely blocking the oxygen supply to your brain. The room is silent, the house is dark, and your brain cells are quietly suffocating. Think of an old rubber garden hose that has been sitting outside in the freezing winter air for 15 years. It has become stiff, brittle, and completely unforgiving. If you gently run a smooth stream of water through it, it works just fine. But if you suddenly force a massive surge of thick, heavy mud through that old, brittle hose, the pressure builds up relentlessly. The rigid walls of the hose cannot expand to accommodate the heavy load. The pressure mounts until eventually, at the absolute weakest point, it cracks and bursts. That is the exact mechanical failure happening inside the delicate vessels of your brain at 3 in the morning when you drink the wrong thing before bed. Your blood becomes the heavy mud, and your aging vessels simply cannot handle the catastrophic pressure. A landmark clinical study published by leading cardiovascular researchers observed thousands of older adults and uncovered a truly terrifying correlation. The scientists discovered that the silent hours between midnight and 6 in the morning are the absolute deadliest time for ischemic strokes. They noted that blood viscosity, the sheer physical thickness of the blood, peaks to highly dangerous levels precisely during these early morning hours in seniors who mismanage their evening routines. The medical journal explicitly highlighted that altering your fluid intake with specific drinks right before sleep dramatically multiplies the risk of this nocturnal clotting. The researchers know this undeniable fact. The hospital administrators know this. Yet when you sit in that sterile clinic room for your brief 7-minute appointment, your physician merely checks your daytime numbers, scribbles on a prescription pad, and sends you out the door. They completely neglect the most dangerous 8 hours of your day, leaving you utterly blind to the biological storm brewing in your bloodstream every night. Understanding this thick, sluggish blood is the absolute key to preventing a catastrophic morning. You don't need to live in fear of the night. You don't need to accept that losing your independence is just a normal part of getting older. And most importantly, you don't need another expensive pharmaceutical pill with a terrifying laundry list of side effects that leave your memory foggy and your muscles aching. There is a beautifully simple, completely natural, and cost-free biological switch you can flip tonight, right from the comfort of your own bedroom, to ensure your blood remains perfectly thin, smooth, and oxygen-rich until the sun comes up. I'm going to show you the exact steps to protect your brain tonight.
I am going to give you the exact blueprint to support your biology and keep your blood flowing smoothly all night long. You do not need to spend a single dime, and you certainly do not need to add another confusing pill to your daily organizer that leaves you with severe brain fog, extreme fatigue, and chronic aches. You just need to outsmart the outdated guidelines that the traditional healthcare system blindly hands out during those rushed 10-minute appointments where you are treated like nothing more than a number on a chart. We are going to implement 4 simple, highly effective steps tonight so you can confidently step away from the fear of losing your independence to a sudden nighttime emergency. Step number 1 is what I call the sundown shift. The massive mistake most older adults make is trying to catch up on their daily hydration right before bed. They realize they haven't drank enough fluids during the day, so they gulp down a massive glass of plain ice water or a large mug of chamomile tea at 9 o'clock at night. That is exactly what forces your kidneys into absolute overdrive and severely thickens the blood left behind in your vessels. From this day forward, you are going to stop consuming large volumes of any liquid exactly 2 hours before you intend to sleep. You will shift your primary hydration window entirely to the morning and early afternoon. By doing this, your kidneys have ample time to process the fluids, your bladder empties completely before your head hits the pillow, and your blood volume remains beautifully stable throughout the most vulnerable, dangerous hours of the night. Now let us move to step number 3. You might be wondering what you should do if you feel genuinely thirsty right before sleep, or if you absolutely need a sip of liquid to safely swallow your evening medications. You are going to replace that dangerous massive glass of plain water with a precise 2-ounce microsip of warm, diluted tart cherry juice. Why tart cherry? Because it's packed with naturally occurring compounds and rich antioxidants that actively fight inflammation inside the delicate vessel walls. But much more importantly, taking just 2 ounces, literally the amount of a standard shot glass, provides the exact moisture your throat needs to comfortably swallow a pill without triggering your aging kidneys to aggressively flush out your vital blood volume. It's the perfect, biologically safe compromise to keep your blood beautifully thin and your bladder entirely empty. Step number 4 is the nitric oxide trigger. This is a brilliant, entirely natural 60-second physical trick that yields immediate biological results. Right after your breathing exercise, take a small rolled-up hand towel. Grip it in your right hand and squeeze it as hard as you comfortably can for exactly 1 minute. Release it and then do the exact same thing with your left hand for 1 minute. When you intensely contract the muscles in your forearms and hands like this, and then suddenly release the tension, you trigger a massive, localized rush of fresh blood. But more importantly, the sheer physical force of this blood flow scrubbing against the inner walls of your arteries commands your endothelial cells to release a powerful, life-saving molecule called nitric oxide. Nitric oxide is the absolute holy grail of cardiovascular health for seniors. It is a highly potent natural vasodilator. That means it acts like a microscopic key, unlocking the stiff, rigid muscles around your blood vessels and forcing them to gently expand and relax. By performing this simple hand grip technique right before lying down, you are physically widening your entire circulatory system. Even if your blood becomes slightly thicker during the deep unconscious stages of sleep, the vessels themselves are now wide enough to allow that blood to pass through effortlessly, completely neutralizing the terrifying risk of a microscopic clot getting stuck and silently starving your brain cells of oxygen. This is the exact life-saving knowledge the modern medical system simply fails to deliver because they are fundamentally obsessed with treating symptoms and prioritizing profits over true, lasting health. They want to keep you dependent on their fractured system, coming back every few months for another rushed conversation and another prescription refill. But you have the absolute power to step out of that vicious cycle today. You can actively manage your health naturally and fiercely protect your precious independence. I want you to write these 4 steps down on a piece of paper right now. Take that piece of paper directly to your next doctor's appointment. Show it to them. Use this exact information to strongly advocate for yourself and ask your physician if your current evening medication protocol is still entirely necessary based on this new routine. You are the ultimate authority over your own body. You deserve to live out your golden years with absolute dignity and autonomy, prioritizing true quality of life over just surviving another day in a state of constant medicated fear. But there is one more critical piece to this nighttime puzzle that you cannot afford to ignore. While you now know exactly how to prep your vessels for sleep, there is a very specific, incredibly common sleeping position that completely undoes all of this hard work the second your eyes close. This seemingly harmless way of resting your head actually kinks your carotid artery, silently cutting off the critical blood flow to your brain while you dream. I need you to do something incredibly important for me right now. Go down to the comments and tell me exactly what time you usually have your last sip of liquid before bed. Are you a 9 o'clock tea drinker or a midnight water glass kind of person? I read your comments, and your shared experiences help everyone in this community realize they are not alone in navigating this confusing system. But more importantly, I am begging you to share this specific video with your spouse, your sibling, or a dear friend who is over the age of 60. Send it to them right now. You hold the power to literally save someone you love from a devastating silent morning emergency. You are giving them the gift of knowledge that our rushed, profit-driven medical system simply does not have the time to provide. Before we take the absolute final step today, I want to remind you that the information in this video is meant to empower you. This is general medical education designed to help you have much better, deeper conversations with your own healthcare provider. You should always speak directly with your doctor before stopping any prescribed medications or drastically altering your daily routine. Use what you learned today not to blindly diagnose yourself, but to fiercely advocate for your own body the next time you sit in that clinic. You are in control of your health. Now, I mentioned moments ago that your sleeping position could be completely undoing all the cardiovascular protection we just built. There is one specific, incredibly common way of resting your head that physically kinks your carotid artery, starving your brain of oxygen while you dream. You need to see exactly what this looks like and how to fix it tonight. Click the video right here on your screen right now and let us secure your independence together.